Hello, Chatham-Kent parents and youth. Good evening. Welcome to our session. We're so excited to be here tonight with you to offer some information on COVID-19 vaccines, especially as it pertains to our young people. But before they get to that, I'm just going to start with a land acknowledgement. So we acknowledge that our community of Chatham-Kent resides on traditional territory. This sacred land is the subject of the Dish with One Spoon Wampum Belt Covenant, an agreement between the Iroquois Confederacy and Confederacy of the Ojibwe and allied nations to share and care for the resources around the Great Lakes. As we gather today on these treaty lands, we have the responsibility to honor and respect the four directions: land, waters, plants, animals, ancestors that walk before us, and all the wonderful elements of creation that exist. It's important to understand the long-standing history that has brought us here today, and to understand where we fit amid that history. Now, land acknowledgements do not exist in the past tense. Colonialism is current and an ongoing process, and we need to be aware of our present involvement. We recognize that a land acknowledgement alone is not enough. Acknowledgement is a starting point as we work towards reconciliation. So please take a moment to reflect on how you plan to take action to support Indigenous communities. So thanks again for joining us. My name is Dan Droulard. I'm a public health nurse with CK Public Health. I've been working here for almost 10 years. Currently, I work in the infectious diseases and emergency management program, and I've provided many vaccines to our young people through our grade 7 school program. I live in Blenheim with my wife and 2 young children. They're too young right now to be vaccinated, but if the vaccines get approved for their age group, or once they get old enough to receive it, we'll definitely be getting it for them. And I was fortunate enough to get the Moderna vaccine when it came available to me, and I decided to get vaccinated because I believe in the science and the facts, and I feel like and know it's the right thing to do for myself, for my family, and my community. So joining us tonight is also public health nurse Kim Logan. Hi, Kim.
Hi, Dan. How are you doing?
Oh, good, thanks. I hope you're doing well too. Why don't you take a moment to tell the audience a little bit about yourself?
Perfect. Thanks, Dan. My name's Kim, and I've been with CK Public Health for the last 7 years. So prior to this, I worked in an acute care hospital in London, Ontario. I'm currently a member of the school health team, and as a member of school health, I provided school-based immunizations to youth, and most recently have been involved with all things COVID-19 related. I also have previous experience in working in our in-house immunization clinics, where we immunize all ages, and also in our school and clinic-based sexual health services. I'm fortunate enough to have received my first dose or my COVID-19 vaccine myself. I decided to be vaccinated to protect myself and my 2 school-age children who are not yet eligible to be vaccinated due to their age. I'm really looking forward to ending this pandemic and being able to enjoy family gatherings and social events with friends and whatnot. I agreed to be here tonight to help support youth and their families to find answers to their COVID-19 questions in order to better support them to make an informed decision about the vaccine.
That's great. Thanks, Kim. And I think we can all agree that we want this pandemic to be over. And it seems that vaccination is our ticket there. So hopefully the viewers will get some value out of our session tonight. So tonight we will have a short presentation, which I'll run through for the audience. And while I'm doing that, and anytime throughout the session tonight, we want to hear what you want to know. So we're going to do a live question and answer session after the presentation. So if you want to ask us a question and you're logged into your Google account watching this on YouTube, you can type your question directly in the comments, or you can also send your questions in by email to ckphucommunications@chathamkent.ca. I believe that link is showing up there on screen right now and also in the comments. I also want to take a moment to just acknowledge the people working hard behind the scenes. Of course, we have people working on the production, putting this on YouTube and getting the questions ready, and a lot of people behind the scenes helping us answer questions. There's Jeff there, and get your questions to us to be able to answer those burning thoughts in the back of your mind about this. So Also, just a note, that presentation date says May 27th. That's when we started drafting this. It did not get updated to the date for today. So we're sharing new information, not 2-week-old information, just for everyone's knowledge. So without further ado, I'll get started. So we'll start with some stories. We have a few of these sprinkled throughout the presentation, and these are local people that we caught at the vaccination center, just to sort of see what brought them in there and the reasons they had behind why they wanted to get the COVID-19 vaccine. So these two young folks are Macy Williams and Easton Atkins, and they're a couple of teenagers. They met at a hockey game when their teams played against each other. They've been dating for about 10 months now. They both enjoy fishing and hunting, mainly for bass and perch, but they say there's many great places to catch bass, perch, and even walleye on Bokejwanong. And when they aren't fishing, Easton works at a factory on the reserve, and Macy works at the pit stop on the island, what she loves for its laid-back atmosphere and easygoing vibe. And now they both live with their grandparents, and this is why vaccination is so important to them. Macy said, "I'm getting vaccinated because I don't want anything to happen to my grandfather." And Easton agreed and says, "I want to keep my grandparents safe." So we'll have a few more of these stories to share throughout the presentation. We just thought it'd be nice to get a little local picture of the reasons why people are making this choice. So we'll get right started with youth and COVID-19. So we know that fewer youth have been infected with COVID-19 than adults, and often don't have those serious health effects all the time that adults, or especially older adults, more frequently have. But youth can play a key factor in spreading the disease. They can get infected from the virus. They can get sick from the virus, including some quite serious illnesses sometimes, and they can spread COVID-19 onto others. And we know that youths aged 12 to 17 are now eligible for vaccination, so we definitely encourage anyone in that age group to make those appointments. So a little bit about vaccines. So a widespread vaccination effort definitely has the power to stop the pandemic, and that's what we're talking about, and that's what we're starting to see with those case numbers coming down and being able to open up here in the near future. Getting the COVID-19 vaccine can help protect you and your family. They stop you from getting seriously sick. They lower the risk of you spreading the disease to others if you do happen to catch it. Important to note that these vaccines are voluntary. They're not mandatory by any means, but they are safe and they are working. The vaccines work best when you get one as soon as you can, and when you get your first dose and second dose as it's required. And until enough people get vaccinated, we still have to be mindful of those public health measures like masking up, distancing from others, and washing our hands. Basically those three things, and a couple others that we've been doing faithfully for the last year plus to be able to protect each other. So next. So getting vaccinated, as I just mentioned, will get us closer to opening up and being able to do things that we all love and miss, things like playing sports, volunteering, going to school, going to work, going shopping, that sort of thing, all those things we want to do and get back to our normal life. So the faster everyone gets vaccinated and the faster we get those infection rates down, the faster we can open up and hopefully get back onto life as we knew it. So we'll pause here to talk about our next group of local people that showed up at the Bradley Center one day for their shots. So this is a family. This is the Ugursel family. I apologize if you are watching and I'm not saying your name right. So we have Mustafa, Munavir, Musavir, and Mikhail, and they all came to the clinic as a family to get their COVID-19 vaccine to make the pandemic a thing of the past. They're originally from Turkey. They moved to Canada in 2001 and to Chatham-Kent just last year, and they're happy to live here, and they're excited to get out and explore everything that this great community has to offer, especially once we get back to a little bit more of a normal state. So Mustafa said, "We're getting vaccinated because we want to keep our family safe and others safe too." Munavir said, "We believe it's important to get the shot before we get back out and go into the public." Musavir said, who's in grade 11, and he's been waiting for his chance to get vaccinated for quite a while, and he just wants COVID to go away. I think we can all relate to that. Mikhail is not quite old enough, though. Mikhail's turning 12 this September, and the family plans on celebrating his birthday at the vaccination clinic, where they'll all come with him to rally around him and get him his first dose of that COVID-19 vaccine finally. So we're looking forward to that day in September when your birthday comes and you can get that dose there, Mikhail. So everybody definitely follow in these footsteps and book those appointments if you're eligible. So let's get into a little bit about how the COVID-19 vaccines work. So the COVID-19 virus is essentially like a ball, and it has a bunch of spikes on the outside of it. And on the inside of it is instructions on how to make new viruses, or RNA. So the spikes on the outside are like tiny fingerprints, and every type of virus has a different spike. And now the COVID-19 vaccine, next please. So the COVID-19 vaccine only has the instructions inside it to make the spikes. So it's not going to carry that other RNA that multiplies in your body and creates more viruses and makes you sicker and sicker. It only has the instructions to make your spikes, or the spikes. Then your body learns what those spikes look like and how to fight them off without, like I said, the danger of your virus being overwhelmed, or with your body being overwhelmed with more viruses. Next, please. So essentially, it's like putting up a wanted poster in your body, letting it know what this looks like, and to take action as soon as you see it. And then your body hopefully won't become overwhelmed. You won't get very sick, and hopefully won't be even transmit the virus onto other people. The mRNA vaccine that's been approved is currently the Pfizer-BioNTech vaccine. The company that makes Moderna has also claimed that their vaccine is safe for 12 to 17-year-olds, but I think they're still finishing up some studies on that, and Health Canada definitely has to approve it for use in Canadians before that we'll see that here. But currently, anyone between the ages of 12 and 17, actually 12 plus, but for the purposes of this presentation, 12 to 17 youth are eligible for the Pfizer-BioNTech vaccine. So are the mRNA vaccines safe? Great question, especially when we're giving it to our children. So researchers have been studying mRNA technology for decades. Also, vaccines have been around for a long time. There's concerns about whether or not vaccines can alter our DNA, and that's not possible. The place where the spikes are made in our body to be able to respond to it is not even close to where our DNA is stored. There's no risk of crossover or alteration of any kind. So next. What about the ingredients? Well, the COVID-19 vaccines contain fat-coated mRNA, which is just the fancy word for those instructions to make the spikes. They contain types of salts and sugars, polyethylene glycol, and water. Many of these ingredients, like polyethylene glycol, are also found in things we use and consume every day, like foods, cosmetics, and each of these ingredients has a purpose and is precisely measured in order to provide that intended effect without any negative effects. It is important to note that, of course, if you are allergic to anything that's in the vaccine, specifically polyethylene glycol, some people are allergic to it, which is very rare, but still happens. Definitely the vaccine is not for you, and there may be other vaccines that do not use polyethylene glycol that you'd be able to receive. And important to note that they purposely did not include latex in the vaccine or its container, because so many people are allergic to latex and they wanted the most amount of people to benefit from them. So now on to some common side effects of the vaccine. So some people may get side effects, some people may not. Some people might be mild or moderate. Some people might get quite severe side effects for a day or two. It all depends on the individual. And just because you get side effects or don't doesn't mean the vaccine isn't working as well. It's just your body reacts to it differently. So most commonly, people experience some pain or redness or swelling on the arm where they got their injection. That's common for most injections. And then for the vaccine itself, some of the side effects people might experience are just feeling tired, maybe a headache, muscle aches, chills, slight fever, maybe some nausea, a little bit of diarrhea. And those only usually last a few days. And it's important to note that it's not the vaccine itself making you sick. So some people think that vaccines can give you COVID-19. That's not the case. That's just the way your body reacts to it to fight off those spikes to be able to do that job efficiently in the future if and when it encounters the COVID-19 virus. Now, on the topic of allergic reactions, I mentioned polyethylene glycol allergies, which are rare. So close to 3 million doses of the Pfizer-BioNTech vaccine have been given to youth ages 12 to 17 in the US, and they've not reported any serious side effects to this date. Of course, vaccines in the US and in Canada are constantly monitored and kept good track of. So if there are any changes to that, we'll certainly let you know, as the government and province did with the AstraZeneca emergency brake they pulled due to that blood clotting issue. So if there is a safety signal to go up, they will pull it and have a look at it closer, but so far there's no reason to do that. So what can you expect at the clinic? So you'll register, probably wait in line a little bit, see a nurse or a paramedic for your vaccine. They'll ask you some questions, talk to you for a little bit, make sure you're comfortable, and then they'll give you the shot. And then they'll ask you to wait in a waiting area for about 15 to 30 minutes afterwards. And so the reason for that is because if you do have an allergic reaction, chances are it's going to show up in that first 15 minutes. If you have other health conditions, they might ask you to wait for 30 just in case. But it's just a safety net just to make sure we're not sending you back out in a time where it's likely that an allergic reaction would occur if you were to have one. So there's nurses and paramedics there and everything we need to take care of people if that happens. Thankfully, it's super, super rare, but nevertheless, we're prepared for it just in case. On to our next story of vaccinated youth here in Chatham-Kent. So this is Colin Fife, and Colin Fife is a grade 11 student at CKSS. He's currently studying biology and leadership as part of his quadmester, something that'll be unique to his generation since COVID's kind of created that for them. He finds online learning a bit challenging, but he misses playing sports at school and the interaction with other students. He likes playing volleyball, basketball, he likes track and badminton. But this past year, he couldn't do his regular job as camp counselor. But he worked at a long-term care home, which was an eye or heart-opening experience for him. He saw firsthand how COVID-19 was affecting our most vulnerable populations, as many were unable to see family. For Colin, getting vaccinated connects back to his health. He says, "I'm getting vaccinated for my personal health." Whether hitting a birdie across the net, running around a track, getting a shot in the arm, or spending time with someone who's elderly that might be missing their family, public health is a practice we all have a role in, including grade 11 students like Colin Fife. So congratulations, Colin, on taking that leap to work with our most vulnerable during the pandemic, and congratulations on getting vaccinated. So how good are these vaccines anyway? All the COVID-19 vaccines in Canada are effective at protecting against COVID-19 and especially serious disease, hospitalization, and death. The Pfizer-BioNTech vaccine specifically is 90% effective between the first and second shot. So when we give vaccines, especially that need booster doses, the motto I know that Dr. Colby likes to use is the first shot is for strength and the second shot is for length. So that first shot you get is going to boost your immunity, give you a high level of protection. And that second shot will boost your immunity a little bit more, but help extend it for a longer period of time. So that's why that second shot is so critical. And based on the US trials, the vaccine was found to be 100% effective after the second shot in youth ages 12 to 15. I believe that data is quite early, but nonetheless, very promising signs. I mentioned this before in the presentation, that you can't get COVID-19 from a COVID-19 vaccine. So The mRNA vaccines that are used do not contain live virus or deadened virus or weakened virus. They only contain those spike proteins on the outside, which the body uses to identify the virus. Now, it takes time for people to build immunity from a vaccine. So if you hear stories of people that were infected after they got vaccinated, there's a pretty good chance that they didn't build immunity from the vaccine before they were exposed to the virus. So for instance, they might have gotten their shot today on Tuesday, and maybe they started to get sick on Friday or Saturday. Well, they would have been exposed to COVID probably the same day they got their shot and didn't have immunity. It takes almost 2 weeks or so for you to build immunity from your first dose of the vaccine. We get a lot of questions, well, not a lot of questions, but it's a fair amount on fertility and menstruation. So especially for our young people, it's something that they have their whole lives ahead of them, want to make sure that we're not doing any damage. So there's no evidence or data that COVID-19 vaccines cause fertility problems in either males or females. It's not clear right now if either getting COVID-19 or getting the COVID-19 vaccine affects menstruation. So the jury's kind of out on both the virus and the vaccine on that right now. And there's many different things that can affect the menstrual cycle, including stress, infections, sleep problems, and changes in diet and exercise. So there's lots of other contributing factors right now that could also lead to a little bit of a difference in cycle too. So people ask about the approval of the vaccines. Of course, we entered this pandemic at the turn of 2019, 2020. And then basically a year later, we were administering vaccines to people, which was incredible. So how did that happen? Well, first thing I'll say is that in Canada, it's illegal to sell or market a vaccine or a medicine that's not completed all stages of research. It has to be approved by Health Canada, licensed to be sold, distributed, used, all that sort of thing. There was a historic amount of money and research that went into developing the vaccines, and that really played a huge part in how quickly they were developed. Even celebrities like Dolly Parton were throwing money at the COVID-19 vaccine research. So when you have that kind of support coming from sort of everybody in every country across the globe, it kind of makes sense as to how this happened so quickly. And another part of it was the researchers and the scientists. It was, a global effort. I don't think there's ever been a period of time in human history where this much energy and resources and human resources went into one thing together. So a combination of all of those things is sort of why and how these vaccines got approved and on the market so quickly to be able to end this pandemic. There's also about the research studies. So of course, to be approved, there has to be demonstrated research to prove it's safe, to prove it's effective. And there was an overwhelming amount of people that signed up to test these vaccines, much more than would sign up for a regular vaccination or medication study. So that definitely helped make the research better, made it more confident in the results, because there was such a large amount of people that took part in it. It made the data easier to translate to the general population. Then, of course, as we continue to give in the general population, we're continuing to monitor and see the effects of that and make sure that it's in line with what we expected. So how do you give the COVID-19 vaccine? Well, maybe some of you haven't because you have missed your grade 7 vaccines for the last couple of years. But the COVID-19 vaccine is given the same as most other vaccines. It's called an intramuscular injection, which means it's a needle in the arm into a muscle. Usually it's just below your shoulder called the deltoid muscle. If you feel your shoulder, there's a little hard spot kind of at the top. And you go about 2 or 3 fingers down, you can feel your deltoid muscle there. So that's where we give the vaccine, the injection. It only takes just a couple short seconds. And most people, after they get it, they say, oh, that was it. I didn't even feel it. So hopefully that's the same experience that you get. Now, when we talk about needles, that makes people very nervous. Some people don't like them at all, which I completely understand. It's not natural to jab a metal object into your body. So here's some tips for you to help you feel more comfortable when you go to get your needle. The first thing I like to remind people to do is to communicate. So let the person giving you the shot know that you're nervous. Ask them questions about the vaccine, Ask them any questions you want. What am I going to expect? What am I going to feel like after? They'll answer all those for you. They'll make sure you're comfortable. It's important they know that you're nervous so they can take that extra time and attention to make sure you're comfortable before you get your needle. The other thing I tell people to do is bring something to distract yourself. Bring a book to read. Listen to music on your phone. Bring your headphones. Look at pictures. Bring a Nintendo Switch. Play a video game. Talk to someone. Whatever is going to help distract you while that nurse or paramedic is giving you that needle. It'll definitely take your mind off of it and hopefully make the experience much better. Also give you something to do for that 15-minute waiting period after as well. And my last tip is try not to look. So especially if you're very nervous about needles, try not to look. Don't watch the nurse or paramedic get the vaccine ready for you. Don't watch them give you the needle. Don't watch them clean your skin with the alcohol. Just try to use those distraction techniques. Pretend you're not there for a minute and it'll all be over soon. So that takes us to our next sort of local story. So this is Kinsey Moon and her mom, Sandy. So you may not recognize Kinsey until you think about ice cream in the summer. She works at a drive-through ice cream shop, keeps us all smiling and cool when the temperature gets hot, which it has started to this week. She and her mom came to get vaccinated at the Bradley Center, and during COVID, they spent a lot of great time together. So why not get vaccinated together too, they thought. So when deciding whether or not to get vaccinated, Kinsey thought about how getting the vaccine would help protect the people around her and help us all get back to somewhat normal life soon. So as soon as she can, she'll be seeing all her friends, and she wants to travel a bit too, which I can relate to. She says, I'm getting vaccinated because I want to make sure I keep myself and the people around me safe. That includes her mom, her best travel buddy, and #1 fan. Well, thanks, Kinsey, for sharing your story, and congratulations on your vaccine dose. So now I'm going to talk about consent a little bit. Especially important when you're talking about young people. So it's important that the person getting vaccinated gives the person giving you the shot consent. So if you're 12 and your parents want you to have the shot, the nurse is still going to wait until you say, yes, give me the shot. They're not going to hold you down and make it terrible. They're definitely going to make sure you want it to. So anyone aged 12 to 17 has to have the capacity to make this decision themselves. And if they don't have the capacity, they need a responsible adult with them to consent for them. So what does it mean to give informed consent? Well, that means that you understand what the vaccine is, what the process to get the vaccine is, the needle in the arm, why the vaccine is recommended, and the risks and the benefits of accepting or refusing vaccination. And all these are things that we're sort of going through tonight. So if you've reviewed this presentation and watched the question and answer after, then you should have all the information you need. But of course, like I said, ask those vaccinators, they'll fill in any blanks you have. So if you are able to provide the consent, we still recommend talking to your parent or guardian or a responsible adult that you trust about your choice. And if you're not able to consent to the vaccine, then we will need your parent or guardian to consent for you at the clinic. And just, we ask the clinic how they're operating that. And basically, they're saying anyone that's under the age of 14 will be required to have a trusted adult with them at their appointment to provide that consent. Anyone over the age of 14, of course, adults' parents are welcome, but we will accept them on their own and immunize them on their own. So that leads us to how do we get our vaccines? So it's been out there for quite a while on how to do this. So we've got a few ways. You can go online at getyourshotck.ca. You can call our phone number 351-1010 and leave a message. Only do that once. It's filled with thousands of messages, and our team is working diligently to get back to people as they called. And so only leave one message, otherwise they'll be reviewing your message more than once. It'll take them longer to get to you. We also have pop-up and community vaccine clinics, which are advertised through our social media channels. So if you made it here tonight, chances are you're tied into one of those already, so keep your eyes on those. And also we have select pharmacies and healthcare provider offices offering the vaccines. So talk to your local pharmacist about getting your vaccination there and see if you can arrange an appointment that way. So this is our last local story of the night. This is Natalie Johnson and her parents Rob and Steph McQueen. So almost 17-year-old Natalie came to our Wallsburg mobile clinic with her mom and stepdad. And as a family, they've taken their dog Oakley on many adventures during the pandemic, oftentimes finding a woodlot of a conservation area to explore or find some fresh air. And on the flip side, they've also watched lots of TV together, finding it a great way to relax together as a crew. Natalie herself has been busy painting murals with permission throughout the house, making sure to keep her artistic interests and techniques on point, even during lockdown. For Natalie, getting vaccinated is about a couple main things. Number one, to make the world a healthier place. And number two, because she really misses playing baseball. She says getting vaccinated is like hitting a home run. Now let's play ball. Hopefully we can get to that playing ball sooner than later. So if there's any, at the end of this presentation, if you're looking for more, definitely look to credible sources to inform your decisions. So our website has a wealth of knowledge and information on it for almost any population or group. It's in several different languages as well. You can find us at ckphu.com and navigate through our COVID-19 vaccine page through there. Other than that, just make sure that if you're seeking other sources that they're reputable. I would recommend government sites and healthcare organization sites and those sorts of things. So make sure you're getting your information from reputable sources. And if you have any questions, feel free to get in contact with us. We're available by phone or online. Our phone number is 519-355-1071. Extension 1900 is our COVID-19 sort of hotline. And I believe our health inspectors are manning that phone line, and they are a wealth of knowledge. And if they don't know the answer, they definitely can find someone who does. So at this time, we're going to get into questions. Jeff in the background will feed us some questions, and Kim and I will answer them. Just a reminder on how to submit questions. You can either do so in the comments on YouTube if you have your Google account logged in, or you can email them to ckphUcommunications@chatham-kent.ca.
Great presentation, Dan. So one thing I did want to bring up is Chatham-Kent has actually reached a milestone already with immunizations in this age group of 12 to 17. So in the first 10 days alone, since eligibility opened for this group, 24% of youth have already had their first dose of vaccine. So that's pretty incredible. So kudos to everyone in Chatham-Kent in leading the way in this effort.
Well, that's great news. What a great start. A quarter of our youth already, 12 to 17. Wow.
Right.
Amazing. Amazing. Well, let's get right to the questions then, Kim, if you're ready.
Sure. Go ahead, Dan.
It looks like our first one is in here. If youth don't frequently get really sick with COVID-19, then why do they need to get a COVID-19 vaccine, Kim?
That's a great question. So, the COVID-19 vaccine can actually help prevent youth from getting and spreading COVID-19. And even though we know that oftentimes they don't get as sick with the COVID-19, it does help to prevent spreading it to families and friends. It can also prevent youth from becoming severely ill if they do get it. So, even though it's less common for them to get severely ill and to be hospitalized, it certainly can happen. We also know that in children, we've seen multi-system inflammatory syndrome in children, and that's a condition where it causes different parts of the body to become inflamed, like your heart, lungs, kidney, brain, skins, eyes, or even your gastrointestinal system. So they don't know exactly what's causing it, but it has been related to the COVID-19 virus. Okay, so actually having that infection. Okay, it also getting the vaccine will help us all get back to our regular lives as soon as possible. Certainly, this pandemic has had an impact on youth in terms of not being able to go to school, youth and sporting events and participating in team sports. Those types of things have been impacted, and even other just social events, right? So definitely, I think there is a benefit to youth being vaccinated as well.
Yeah, good points there, Kim. And I think it's really important to to emphasize that even though we don't see the rates of serious illness in children, it definitely can still happen, right? And nobody ever knows who or when that's going to be. So
That's right.
all right. Do we have another question? Okay, we have a question from Silky Wilkification. Thanks for joining us here tonight. Are there benefits to get past herd immunity, or does it end there? Like, does it end once we reach herd immunity, I guess? Is there any benefit in exceeding the herd immunity threshold?
Yeah, so herd immunity, I'll just explain a little bit. So, what it means is that if enough people are immune to the COVID-19 virus, meaning then it's less likely to spread around, right? Because people aren't catching it, so then they're less likely to spread it to others. So, we do need quite a high level of vaccination in the population to actually reach that. So, it's estimated we need about 70 to 80% or possibly more of the population to be vaccinated in order to get back to our daily lives, reopen businesses, hug and see our loved ones again. So, like the more people that are vaccinated, essentially, is the better. What herd immunity is great for is protecting those people that may not be able to get vaccinated right now. So, people that may have a severe allergy to that polyethylene glycol that Dan mentioned is in some of the vaccines. So those individuals benefit from herd immunity because it protects them. It also protects, in the case of young children who cannot yet receive the vaccine, if their family members, teachers, or anyone that they're having contact with as adults and youth are all vaccinated, it's much less likely that that infection could be brought home. So definitely there are benefits to herd immunity. I don't know that there, is any drawbacks to having a very high percentage of the population vaccinated. So I guess the more the better in terms of herd immunity, because we don't know exactly what that level is with this particular virus, especially with the new variants that we're seeing that are much spread much more easily.
Yeah, I think that's important to mention is those variants of concern that are circulating, and it's not a guarantee that there won't be another one pop up that might not be more dangerous, right? So I think it's important to protect ourselves if and when we can. So next question we have here, Kim, is can we achieve herd immunity without children being vaccinated for COVID-19?
Okay, that's a great question. So it really depends on the amount of youth in the population. But we know that with such high numbers required to reach herd immunity, like that 70, 80% and above, that really I don't think we can reach herd immunity without children being vaccinated, because it does require those very high levels of immunization to get that effect. And also, like we discussed, the variants, right? What variants of these variants of concern, what happens is that they're identified as a variant, which is basically like a mutation of the virus. And they're a variant of concern when they become more transmissible. So they're able to spread more easily if they cause more severe illness, if they are not as if they are able to basically make the vaccine not as effective. So there's some variants that potentially could reduce the effectiveness of our vaccine. And the other reason that we call them a variant of concern is if they are not able to be detected on our standard COVID-19 tests at this time.
Yeah, lots of good information there, Kim. And it's important to note that there are a fair number of people that probably can't get the COVID-19 vaccine or other vaccines for, allergy reasons, or whether they're on certain medical treatments or getting, cancer treatments, that sort of thing. So it might seem like that it's easy to get to herd immunity, but there is a certain amount of the population that's not allowed to get vaccinated. And that immediately takes a certain percentage of the population out to be able to achieve that herd immunity, right? So it really is important that everyone does their part and steps up and does what's best for the community.
Yeah, Dan, you bring up a good point about the people that are on chemotherapy and drugs that impact your immune system, because certainly they, even though they can still receive the vaccines, we know that they may not work as well in people that have those such sorts of things. So that's definitely a great point.
Yeah, thanks for clarifying that. Looks like we have our next question in, if you're ready. If my child already had COVID-19, do they still need to get vaccinated?
So studies actually show that even if you have COVID-19 infection, that protection from that, the natural immunity, is only estimated to last about 3 or 4 months. We're not exactly sure how long it will last long term. Definitely, there have been cases of reinfection with COVID-19, so meaning you actually catch the virus for a second time, probably mostly related to those variants, right, where it's actually a mutation and the virus has changed, a little bit. So the vaccine is certainly still recommended in those groups. You definitely don't want to get the vaccine, if you're still actively ill with COVID-19. But once you recover from that illness and have completed like your quarantine period and whatnot, your isolation period, and are cleared by public health, as long as you're feeling well and you don't have any other reason not to be vaccinated, then we certainly recommend that to give you better long-term protection with the vaccine.
Yeah, I was just going to mention that as well, is that it's almost like getting a second dose, right?
Exactly.
And boosting that natural immunity, giving you that length and added protection, that we were talking about in the presentation. So,
Right.
but still important to get the second dose of vaccine, even if you've already had COVID-19 as well, right?
Exactly.
All right. So our next question is there any difference in the ingredients or dosing of the Pfizer vaccine for our 12 to 17 group compared to adults, or is it just the same across the board?
Yeah, great questions coming in tonight. So no, there's actually no difference in the ingredients. So exactly the same ingredients that Dan went through in the presentation there. And like Dan said, we find most of these ingredients in things that we use every day. So there's not very many things in the vaccine that actually people are commonly allergic to. Even the polyethylene glycol component, it's not something that most people are allergic to, but certainly a concern for those that are. So the dose is exactly the same for the 12 plus, and the ingredients are exactly the same. So no change there at all.
Yeah, and that aligns with other vaccines. I mean, when we go for our tetanus shot, it's the same dose for the 16-year-old as it is for the 46-year-old. It's the just the amount of vaccine it takes to get the job done. So thanks for that
Okay.
answer, Kim. I'll just remind our audience here to submit their questions. If you're logged into your Google account, you can submit your questions in the comments of the YouTube page, or our email address is now on the screen. We'll leave it up there for a bit. It's a bit of a long one. CKPHU communications at chatham-kent.ca. We'd love to hear from you and provide some answers to those questions you've been wanting to ask. So we'll take our next question here. About how long does the vaccine take to work?
Yeah, so the vaccine takes about 14 days after the first dose to get about that 90% protection that Dan discussed. The vaccine's not fully protective against COVID-19 until you actually have both doses, okay? So once you get that second dose, then you're going to wait another 14 days, and then you're considered fully immunized at that point. So 14 days after the second dose, considered fully immunized.
Okay, so about 2 weeks then.
Yes.
That's not too long. It probably feels like it is, but it's not as long as we would think. Definitely after having spent 15, 16 months in a pandemic. So that's great. Um, Next question in here, Kim. Oh, this is a good one. Are there any side effects that are more common in youth than we've seen in adults?
So actually, yes, there are. So we do see that youth tend to sometimes have a little bit more headache, which is a common side effect with this vaccine. They can also have a little bit higher rates of fever and also chills than adults. So this actually isn't really surprising, though. These things are usually time limited, so they only last for a couple days, typically after immunization. And certainly you can use medications if you do feel unwell and you need to, reduce any fever or anything like that. So Tylenol and Advil are usually the things that are recommended after the vaccination for those types of issues. It's not really surprising that like youth do have a greater incidence of those types of side effects, and the reason is because we know that youth actually have a stronger immune system than adults. So where it's not really surprising at all that they do have a little bit more of these types of side effects. But usually, like I said, they resolve within a couple of days. Oh, we just lost our lights here. Sorry, we'll get that fixed.
There we go. Timed out on us, I guess. Yeah, those are all good points there, Kim, about ways to reduce those side effects after they experience them. Would you recommend that parents give their children medication before their vaccine appointment?
Good question, Dan. So no, we don't actually remember or recommend, sorry, giving Tylenol or Advil prior to immunization or at the time of immunization, because with some vaccines, we know it can affect your immune response a little bit. We don't know for sure with the COVID-19 vaccine. So just as a precaution, we recommend only giving it afterwards. So if you do have those side effects and you feel like you need it in the days after immunization, you can certainly take that, but we definitely don't recommend taking it in advance or at the time of immunization.
Okay, I think that's good information for everyone to have. Do we have any more questions, Jeff? Okay, looks like we have a question from Tim. Tim's asking, what does the shot feel like?
Great question, Tim. It's one we commonly get with our school immunization clinics, especially when everyone's a little bit nervous. So the shot is usually, it feels like some pressure, usually. Some people say it feels like a pinch. Like Dan mentioned, though, in the presentation, sometimes students often say to us, "Oh, I didn't even feel that. Are you done already?" So they actually don't feel it. The best thing that you can do during your immunization, if possible, is to stay still while your provider is giving that to you. We ask that you keep your arm as loose as you can. So in school clinics, we often say if you can let your arm hang like it's a wet spaghetti noodle, and just keep your hand in your lap nice and loose, usually that helps to reduce that pain as well.
Yeah, that's great. And especially I think using those distraction techniques I mentioned before, and that can help take your mind off of it and help reduce any sensation you feel for sure.
For sure. The more prepared you are coming to the clinic, usually it goes better. So, the other things you can do to come prepared is to make sure that you wear a short sleeve shirt. Like Dan mentioned, that needle is going into your deltoid muscle, so in the upper arm. So, if you do have a short sleeve shirt, even if you wear, a hoodie, and if you need that for the air conditioning and those types of things, that's fine. Just so there's easy access there for the provider. The other thing you can do is actually make sure you have a snack or a meal, shortly before your immunization, and keep yourself well hydrated. If you do forget to bring a distraction technique like a book or a switch or music, whatever you were planning on, some other strategies you can try during the immunization itself. Some people like to wiggle their toes. That helps to distract them a little bit. If you want to skip count back from 20, something like that, that makes you think a little bit about your counting, right? Or even like squeezing your thighs together during the immunization. Those things do help for some people, and certainly for youth, deep breathing it definitely helps to try and calm the nerves and to kind of keep that anxiety at bay a little bit.
Those are all great tips, Kim. You can tell you've been doing this for a while and probably given lots of shots.
Yeah, definitely.
And thanks, Tim, for that question. We appreciate your participation. Looks like we have one here from Cindy now. Thanks for sending in your question, Cindy. What if I fainted the last time I got a vaccine or I'm afraid of needles?
Yeah, great question, Cindy. So definitely, lots of people have had this experience. So you're not alone. So people, if you have fainted, what I would recommend is let your provider know that you have a history of that and you have a fear of needles, and then they can do more to support you through your immunization. I know that at our CK clinics, if you do need to lie down during an immunization, sometimes that helps with these types of faints and these sort of events. So if you let your provider know, they can certainly offer you a cot to have your immunization that way, instead of sitting up in a chair. And definitely you would be monitored afterwards, as everyone is. But even if you needed to lay in that cot for a little bit longer after your shot, that would be perfectly fine. So just that good communication, like Dan suggested in his presentation, I think is the best way to manage that. And also using these distraction techniques and whatnot often helps. But just communicate that you've had that issue in the past, but it does not mean that you are more likely to have this again necessarily.
Okay, yeah, those are great pointers, Kim. We have a question here from Michelle. Thanks for your question, Michelle. So Michelle read that the vaccines can cause swelling and fluid around a child's heart after the second shot. She wants her child to get vaccinated, but she's concerned. And I can understand that. Kim, do you have anything to share with Michelle to help her make a decision?
Yeah, absolutely. So, Michelle, the conditions that you're referring to is actually called myocarditis and pericarditis, and that's actually inflammation of the heart. So, there have been some indicators in rare cases in other countries. They have seen this. It tends to be more common after a second dose of vaccine within a few days, is very, very rare, and is something that they are doing further investigation on to see if it's actually related to the vaccine at all. Because at this point, we really don't know. In Canada, the Public Health Agency of Canada has put out a statement saying at this time, we don't see any different rates of myocarditis or pericarditis in the population than we would normally. So there's no link at this time to the vaccine, but it's definitely something that is under investigation, which is a good thing, right? It means that these safety checks and balances that we continue to monitor for these things, even though we're using these vaccines, right? So that's a good thing. The other thing to note is that it tends to be more common, like I said, after the second dose, in youth males, but is very rare, and that it's very quite easily treated actually. So usually it responds well to rest and medicine, and the people that did have this improved very quickly afterwards.
Kim, do you know what a parent would be looking for or what a youth might feel like if they're experiencing a myocarditis or a pericarditis?
Yeah, absolutely. So you would feel chest pain potentially, a little bit of a short of breath, or feeling like you're having, your heart beating out of your chest, or like an abnormally fast heart rate or fluttering heart. So they definitely, if you have any of these symptoms, it requires emergent medical attention just to check it out and make sure that everything is okay. But like I said, there is no link to the vaccine at this time. It's currently under investigation, and there have not been any fatalities at all at this point. So no deaths. And certainly we know with COVID-19 itself, right, with these viruses that they can cause sort of permanent effects in some people, right? We do hear about these long haul syndromes where people can have, heart and lung issues quite a time after having, natural infection with COVID-19. So this is still under investigation, and we can certainly give you some more details when that becomes available. But at this time, there is not associated with the vaccine, and there's been no breaks, I guess, in immunization related to this.
Yeah, and I guess you also mentioned that multi-system inflammatory, disorder, I
Syndrome.
guess,
Yeah.
syndrome that children tended to get with COVID-19, and whether or not myocarditis and pericarditis is directly related to that, I would say that there's probably a risk in that through COVID infection, as you alluded to, right?
Yes, I
And
would think.
probably more common than through vaccination.
Yeah, I would think so as well, right? Because with that syndrome, we also know that it does cause inflammation in organs like the heart and lungs, and actually multiple organ systems. So yes, I would think also that there is a risk in inflammation that way. So definitely, myocarditis and pericarditis can be related to infection with viruses and whatnot.
All right. Thanks so much for that information, Kim. And I hope Michelle appreciated that as well. And Michelle, if that didn't really answer all of your questions about that, and you have more, and you have a healthcare provider, I'd encourage you to follow up with them for maybe a little bit more information, especially specific to your own family and the individuals you're thinking about. So. Just another reminder to everyone, if you have any questions for us, submit them in the comments section on YouTube if you're logged into your Google account. Otherwise, you can email them into us at ckphucommunications@chatham-kent.ca. I think we only have a couple left, so we'll be wrapping up shortly unless we get a few more, but we're happy to continue on right now with the next one. Do we have another one right now? Second doses. Why were second doses delayed? Is it safe to delay second doses?
Okay, so second doses were actually delayed because of the vaccine supply at the time. So initially, we were having supply issues, as many of you know, and it was taking a little bit of time to get these vaccines actually into Canada and then distributed to the provinces. So the thinking at the time was that we need to get more people immunized so they have some protection, right, with that first dose, because we know that the first dose is quite effective. So, as far as it being safe, yes, it is safe to extend the time in between shots. We commonly see this with even our routine immunizations, right? We often have minimal sort of intervals, they're called, but that means the minimum amount of time, to your second dose. So it's very much the same. And also, we studies show that with the second doses delayed, there actually may be a better immune response with delaying that second dose. Certainly, you get it as soon as you're eligible for the second dose, if you can, because it gives you better protection long term and overall. But there is not any harm in getting that second dose later. Um, than the original direction from the manufacturer.
Okay, that's good information. Looks like we have another question. Will I be receiving the same vaccine at my second dose? It's a popular question these days.
Yeah, it is. So with this age group, you mentioned in the presentation, Dan, that only the Pfizer and BioNTech vaccine is approved for this age group by Health Canada. So at this time, definitely we suspect that your second dose will be the same product. That being said, recently it has been approved to intermix vaccines. Okay, if needed. Okay, so if there is lots of Pfizer BioNTech vaccine available, and that's what you had for your first dose, more than likely that's also what you'll have for your second dose. But if the other mRNA vaccine that is being investigated is approved by Health Canada by the time that you're due and eligible for your second dose, there is a potential that you could have that vaccine. And the immunization experts in Canada are saying that is safe to do that if needed.
Yeah, that's great. And I think that's really only for situations where the first vaccine's not available, right, Kim? Like we'll do our best to get you the same vaccine for your second dose.
Yeah, that's right. And we know that the Pfizer supply is really good from what the government is telling us right now. So we anticipate that you would have the same vaccine for your second dose.
Okay, great. Thank you. I think we have time for about two more questions. If we have two more questions in. Oh, I like this question. Once I receive both doses, do I still need to wear a mask?
Great question. So definitely, I think this one is something that a lot of people have on their mind. So at this time, yes, we still need to continue to follow public health measures like wearing a mask, doing that physical distancing, and hand washing until a higher percentage of the population actually has both doses of the vaccine. So society in general is expected to switch over as we all get protected with both doses. So it is going to take some time, but for now, now, yes, you need to continue following public health measures. And I think gradually legislation will come into place to sort of loosen things further as we go here with the vaccination efforts.
Yeah, it's definitely something on everyone's mind. I don't think we ever thought we'd be in a position where we'd have to do this. I know I've seen it like on the news. If they show, they used to show footage of China and it'd be popular there, people in busy airports, but we're living it now, and I can't think we all can't wait to get it over with soon enough, right? So looks like this is our last question, if I'm not mistaken, and it's from Tom. So thanks, Tom, for joining us tonight. When do I get my second shot? Will it be in time to go back to school? That's a
Yeah,
great question,
it
Tom.
is a good question, and this seems to change regularly. But based on the information we have right now, we think it'll be about 8 weeks to have the second shot. By the time you return to school, you should have that second dose completed. Okay, so by September 2021, we do anticipate that you'll be able to have your second shot done before return to school, which is wonderful news, right? Hopefully, then sports and all those regular activities, those extracurriculars that go along with school, will be back in full force.
Yeah, hopefully. I guess just to add on to that, I would just encourage all our viewers to keep apprised to the news and to our social media channels. We what we're providing today to be 12 weeks, 10 weeks, 8 weeks in the future. A lot can change between now and then, and there's a chance maybe it will be a little bit sooner than that, maybe a little bit later, but just keep apprised and just trust that we at CK Public Health will let you know when it's your turn as soon as we know that it's your turn. So I guess that's it for our questions for tonight, Kim. Is there anything else you wanted to let the audience know before I close?
Yeah, so we're going to add some resources here in the chat for you to follow. Like Dan mentioned, the vaccine intervals, they do change regularly. The best place to find that is actually on our website. We regularly make posts as direction changes and more vaccines become available to let you know when you can book that second dose. But definitely, if you still have concerns about immunization and we didn't address all those, you can contact us for further information if something comes up after the fact, or if you're still feeling a little bit concerned about immunizing, you can always talk to a trusted adult. So definitely pediatricians, family doctors, nurse practitioners, pharmacists, they'd all be great sources of information. And we do have some great websites to share as well. Many of them are from pediatricians and also pediatric hospitals. So they are coming, for an appropriate source specific to children and youth.
That's great. Yeah, the information is definitely out there if you want to look for it. And like Kim said, feel free to connect with us at CK Public Health anytime you have a question about COVID-19 vaccination or anything else we do for that matter. We're definitely here to serve the community. We're members of the community, and so we have a vested interest in helping protect it. And this is right now what we need to do to protect it is get everybody COVID-19 vaccines. So thanks everyone for joining us tonight. I hope this session was informative. I hope it helped some of you clarify some questions you might have had, maybe move you a little bit closer to making that decision to get the vaccine for yourself and your family. And that's it. We'll close. We'll say happy Tuesday evening. I hope everyone enjoys the rest of their night. And we're here if we need you, or we're here if you need us. Take care.
Bye, everyone.